they be downloaded as PDFs on your rsny.org website?
Well, you tell us how to do it because I'm not an expert in the field. So tell us how you find it.
Yeah, I think if you go to rsny.org, if you go to the homepage and scroll down, there's a little title that says, latest publications.
Uh-huh.
There you will have the body radiosurgery booklet, the brain radiosurgery booklet, the prostate cancer booklet. It looks like two other things, but those first three are available in PDF format, so you should be able to download those booklets and see a lot more of this stuff.
Well, it's interesting that you bring that up because actually the third caller that I got between shows was a person who had a Merkel cell cancer of the face, so very similar to that woman that you're referring to. And Merkel cell is a kind of skin cancer, probably sun-related. She's on chemotherapy elsewhere, and the chemo's not working. And they asked, could our technique help her? And again, I said, most probably yes. We have a lot of experiences treating skin cancers, especially around the eyes, nose, mouth, and ears. These are parts of the body that are very, very hard to technically operate on and leave intact. Almost by definition, when you start operating on it, you're not leaving it intact. And so we have a lot of experience in that regard, and people should seek other opinions. And I always tell people, when you want a fresh second opinion, sometimes people say, well, I'll go back to my first doctor and ask him what he thinks. But really, a fresh second opinion means you go to another doctor and sit down with the other doctor and let him examine the records and examine you, the patient, and give you a fresh idea of what's going on. That's what we try to do for our patients, to give a fresh idea, not to funnel through the same old ideas, because the same old ideas will not really give the patient a chance for a new opinion.
Exactly. And, I have a question based on something you said before. Why would someone who's on chemo, why would chemo fail to work for some people and then chemo works great for other people? What's happening?
Well, first of all, there's many, many different kinds of cancer, and there's different rates of response. So, for example, with testicular cancer, chemo has high rates, 80, 90% rates of response. Other cancers, like we'll talk either tonight or in subsequent shows about clinical protocols where the response rate is for 1 month on average or 3 months on average. So it's different cancers. The cancers learn to mutate or change with time. So is it the first-line treatment? Is it a new case? What kind of case it is? How extensive it is? What's the condition of the patient? So there's many reasons for chemo to have varying response rates. We have a caller, Rocky from New Jersey, who's asking a question of us tonight. Hi, Rocky. How are you?
I'm good. Thank you. I'm really enjoying your show.
Thank you.
I just wanted to respond to the discussion you were having about prophylactic mastectomies.
Okay.
And to share my experience. First, my father has stage 4 metastatic prostate cancer.
Okay.
So, I'm very sensitive to cancer in general right now, but I watched my mother suffer and die 5 years ago from breast cancer.
I'm sorry to hear that.
Yeah, and she was 67, had a very, very aggressive form. My grandmother died of breast cancer, and there's a lot of uterine cancer in the family. So I go to a specialist, but I seriously have considered getting a prophylactic mastectomy.
Now, have you done genetic testing to see if you carry the BRCA gene?
I don't have the BRCA gene, but my doctor still considers me high risk, so I've been getting MRIs in addition to mammograms, but I've had 3 biopsies. And I'm choosing not to do it right now, but I have seriously considered it. And I understand why women, I guess, who have watched someone that they love suffer so much.
Well, but your situation is a little bit different than what I was trying to explain. And your situation is that you have a very strong family history. And so you don't carry the gene like Angelina Jolie carries the gene, but you have a very strong family history in 2 generations before you. So the family history tells you something, and that's obviously critical. The article that I was talking about, however, was normal women, let's say women who have breast cancer, but there's no family history, there's no BRCA gene, they have one small breast cancer and then nothing in the other breast, the risk of them, if you follow them for the rest of their life, is about 1%. So the question is, if you had a 1% chance of breast cancer, would you remove the breast for 1%?
Yeah, I guess I've seen so many women that are young and friends of mine, and I don't know, maybe it seems to be happening so much more frequently now. If I was diagnosed, I would take them both off.
Okay, well, look, it's a free country, and you can do whatever you want. Most of us try to use scientific data to tell you, okay, you can, for a woman who has a small breast cancer on one side, nothing on the other side, no risk factors, she's removing the breast pretty much for nearly no reason. And one other thing you should understand is that you can get breast cancer even after mastectomy. So mastectomy isn't 100% guaranteed that the breast cancer will never come. And people need to understand that as well.
Yeah. No, the only reason I called was that the other gentleman was just couldn't understand why some women want to do this, and I just wanted to give you my perspective.
Well, I appreciate that, and I think that there are people who have true risks and other people who have true fears. And I think when Angelina Jolie, for example, made her decision, she went to a geneticist and she went for genetic counseling, and she knew her exact risk, and she was going to take down the risk from 80%, which is her risk for breast cancer, down to about 5%. So in her case, it's a little bit different than the woman that's going from 1% risk probably down to 1%, because they still have a risk after mastectomy to get cancer to come back. So she was taking a step and had a true potential benefit. Other women probably don't have that same potential benefit if there's not the BRCA gene, for example.
Right. All right. Well, thank you.
Thank you very much for calling in, and I hope you have a great week.
Well, that sure cleared things up.
Well, it's helpful, and everyone has their own perspective, and I appreciate her perspective as well. And
yeah, but what I like is how you mentioned that if you're at a 1% and you have them removed, but you're still at 1%, that you're not really helping anything.
Right, but sometimes you're treating the fear and not the actual cancer, and that's what I was trying to talk about. So Angelina Jolie was treating a real issue, and she probably had the best surgeons and the best geneticists, and every woman really who does a radical surgery should have access to a geneticist and speak to various doctors and make sure that her decision or his decision is well-grounded and is going to offer some benefit. Because as I mentioned before, there's a complication rate, and there's a complication rate with everything, and you have to balance out the risks and benefits.
Absolutely.
I wanted also tonight to remember Tom Fry III. Emil Tom Fry III was my chief when I was at Harvard, and Tom Fry just died. He was born in 1924 and died this year. He was a beloved chief. He was in charge of the Dana-Farber Cancer Institute. It was started by Sidney Farber in the 1960s. Sidney Farber was a doctor who lived in the Dana-Farber Cancer Institute. When you talk about people who make their work their life, he made his work his life, and eventually died. And Tom Fry was chosen to take over his position as director of Dana-Farber Cancer Institute. He was my director throughout my stay in education at the Dana-Farber in Boston, and had done most of his critical work on combination chemotherapy. So nowadays, when people get chemotherapy and we use multiple agents, it's almost considered routine. But back in the 50s and 60s, it was not routine. And he took up to 4 different drugs and was treating children with acute leukemia. And in those days, it was uniformly fatal cancer. And thanks to his work, during that time, the survival rate went up to 40%. So you can imagine going from 0 to 40. And based upon his work, it actually exceeds more than 80% today.
Wow. Sounds like a pioneer.
So Tom Fry was a great pioneer, was a great chief and a friend. Other doctors paid tribute to him. Some of my friends from Dana-Farber, Art Scarin and George Canellis, also were there when I was there. Also did other work. He developed work for non-Hodgkin's lymphoma, did chemotherapy, radiation, and surgery for osteogenic sarcoma. In some of the tributes, the son of Senator Ted Kennedy, Edward Kennedy Jr., actually, most people know, had osteosarcoma in 1973 when he was 12, and he spoke about that when he delivered the eulogy for his father. Well, Ted Kennedy Jr. is now 51, and he said, "My father obviously had incredible resources in terms of being able to identify the most capable people. Of all the people in the world, he asked Dr. Fry to take care of me." So it's quite an illustrious eulogy. He was a great man. He lived in Boston during those years and later in Illinois, staying at the home of his daughter. So he died after a long life and a very productive life. And again, most all of us will remember him very, 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 very warmly. In other cancer news, one of the big threats to people with cancer is to get blood clots. So I don't know. Have you heard about blood clots, Rob? Do you know anything about that?
No, I've never heard of that. So in other words, you're trying to say if someone's prone to blood clotting, that there's a cancer connection?
Well, that's one issue. Actually, sometimes the cancer is diagnosed when a seemingly normal, healthy person starts developing blood clots. So that's one thing. And then there's the opposite, which is cancer patients are at much greater risk for blood clots in the veins, the legs, and those blood clots can travel to the lungs or the heart and cause symptoms or even death. And so there's a big emphasis right now in cancer patients to treat cancer patients to try to avoid blood clots. Now, I have one patient who's probably listening tonight, a wonderful woman, and we diagnosed a blood clot in her. She had some slight swelling. The diagnosis is easy. We did what's called a duplex, which is like a sound wave test into the veins, and found the blood clot and the recommended treatment. We're going to go to a commercial break first, and then we're going to talk about recommendations for blood clot treatment and prophylaxis just after this break. So stay tuned. For new or recurrent cancers, Radiosurgery New York specializes in non-invasive radiosurgery. First in America with body radiosurgery, we have decades of experience. For primary or metastatic, large or small, lung, liver, breast, brain, pancreas, prostate, kidney, bone, adrenal, melanoma, sarcoma, and more, innovative radiosurgery hits the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the pioneers in radiosurgery. We may offer a second chance even if chemo, radiation, or surgery didn't work. Treatment here is outpatient with most insurances, Medicare, Medicaid accepted. Our fresh second opinion could change your life. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. We're super convenient, 38th and Broadway in Manhattan. Call 212-CHOICES, 212-CHOICES to hit the cancer.
News Talk Radio 710 WOR.
For new or recurrent cancers, Radiosurgery New York specializes in new, non-invasive cancer treatment choices. First in America, first in New York, first for you, body radiosurgery cancer treatment. Decades of experience with primary and metastatic, large or small cancers. Cancer treatment from head to toe, acoustic neuroma to prostate cancer. We hit the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the cancer treatment radiosurgery pioneers, with possibly a second cancer treatment chance for you, even if chemo, radiation, or surgery didn't work. Our cancer treatment is outpatient with most insurances, Medicare, Medicaid accepted. Minutes could change your life. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. Ask us about hyperthermia, too. We're super convenient, 38th and Broadway in Manhattan. Call 212 Choices. 212 Choices to hit